Good afternoon and welcome to our healthcare panel discussion session. Today we're going to share some insights on how healthcare norms are shifting and ways Jamf partners with other organizations to help your team be successful supporting your health system's needs. Over the past couple of years, health systems have started looking more intently at how to streamline care, be more mobile, and help provide care in the communities in which their patients reside. There are many communities that have limited access to care, and one of our partners, Butterfly Network, is changing how consumers, organizations, and communities receive care. So again, thank you for joining us. I'm Brian Moreno from the Technical Partnerships and Alliances team here at Jamf, and I'm focused on healthcare. I've been with the Jamf Partner Program for about 8 months, and I've worked in healthcare for a little over 20 years. My passion for healthcare started extremely early. And I've worked in healthcare, hospitals, IT departments for 10 years in Southern California, then was fortunate and traveled the United States, working alongside clinicians, physicians, everyone in the organizations, including the community members, to deploy clinical communications and clinical workflow improvements. And then found myself on the Apple Healthcare team, and now having the pleasure to help organizations and apps partner deepen their ability to integrate with Jamf and to ensure that your life is a lot less manual. And now let me introduce you to Brandon. Brandon, over to you.
Thanks, Bran. Hi, everyone. It's a pleasure to be here. As Bran said, my name is Brandon Fagoli. Today, I work at Butterfly Network, and I'm the Director of Product Management here. I'm focused on our enterprise solutions, and I've been with the company for about 4 years. I've done just about every role in the company, but the one that I'm working on today is most special to me. It's about how we take our amazing technology and put it in the hands of our most complex, most sophisticated systems in the entire world. I began working at Butterfly in 2018. We were a small company. We had very little, and my first conference that I went to is where we decided we were actually going to implement Jamf, not as a partner, but actually as a vendor for Butterfly. We had tons of mobile devices we had to manage, and after leaving that conference and being the most junior one on the team at the time, I was left to manage all of those devices myself. Not a week later, we implemented Jamf, and not only have they been amazing partners to us, but they've also been core to our ecosystem and today to our product. And we're going to spend a little time talking about that today.
Thanks, Brandon. And that reminds me, I had an experience that I think a lot of our team members who are here with us today can really appreciate. Similar to yourself, working in a hospital with an IT department, I was manually configuring 100 iPhones, one by one, click by click, tap by tap, and had a little closet of an office. And when an Amber Alert went off on a Sunday at 2 a.m., holy heck, that scared me. So I think now that we've seen the adoption of MDMs like Jamf and great organizations like yours building these integrations, we're going to have a lot to share today. So let's keep
Absolutely.
going. What we're going to talk about today, as you can see, there's a lot of different pieces that we're going to focus on. How is Jamf making strides in healthcare? Where are our partners improving the workflow? And how is Butterfly Network making these strides in deploying their technology to improve patient results? In today's session, Managing Care with Patients Are, Brandon and I will provide you how Jamf is working to help organizations and systems identify best practices, improve the workflow, and support a zero-touch deployment. One way our healthcare team helps your leaders identify new opportunities is through providing your input to help our team identify partners to build integrations with. If you're working with certain organizations, software companies, application developers, and you feel like there might be an opportunity for it to be improved, or it's not integrating with your Jamf network and how you're deploying and managing these devices, we're here to help. So let your Jamf resource know. And we're also going to dive into how our partner Butterfly Network explored how they're changing patients receiving care and diagnostics without boundaries. How our two platforms have come together, and how can this help you? What does it mean for you? As Jamf has worked in the healthcare environment for a while and worked with a lot of your teams, we've focused on 3 pillars. working on the patient experience, clinical communications, and telehealth. And as your organization is reviewing the workflow for patient experience, you may begin the journey as the patient arrives to the moment they discharge the health system. But if you reflect on what patient experience means to you and to your organization and the resources you work with, I think about the moments where I've been a patient or I've been a visitor for a family member or someone I know that's in the health system. The waiting and uncertainty of not knowing what's next or not feeling connected and deeply aware of when's the next time I'm going to see someone because I'm a little too timid to ask for something as other people's needs might be stronger than mine. As you approach the conundrum of how to select the right systems to implement and reduce duplicity and streamline care, the healthcare experts here at Jamf are willing and able to help you. We have a wealth of partners that support areas such as wayfinding, patient engagement, infotainment, patient experience, education, discharge instructions, and like Butterfly Network, working within the health system, in clinics, outside in the community, and in any areas to help patients get care when they need it. Our goal is to make a seamless experience, providing a managed device that can ensure that your patient has the tools and not adding any IT responsibilities to the clinical team. Each of you have probably heard so many times the pushback that the IT team may not be on site and clinical is not going to step in and do the role of yourselves. And if your organization has bedside iPads deployed and are looking for new and innovative ways to ensure that the clinical team is not acting as IT, Jamf has our healthcare listener, which allows for systems to listen to ADT calls and know when that iPad should be digitally sterilized. Some other workflows include the ability for you to use that same process and be able to deploy that and wipe the Apple TVs. So now we're modernizing the environment, allowing for additional tools, functionality, and ways that you can utilize Apple technology seamlessly in your organization. You can enhance with digital signage, messaging, and really provide that true five-star guest experience. When we transition from the patient to the clinical team, clinical communications and process workflow enhancements have been a major focus for us for a long time. We've worked with so many of your teams and your resources to build up how to best use those devices. As your team is looking to reduce duplicity and adopt more smart technology, let Jamf support the workflow to decrease the amount of time logging in and out, syncing passcodes, searching for applications that your team needs. Regardless of the deployment model, whether it be one-to-one, shared, a BYOD strategy, Jamf's management solutions can ensure that your users can pick up an iPhone and have all the tools they immediately need available. And with our security products, safeguarding connects and protect endpoints from threats. And lastly, when you're planning that mobility strategy, the ability to consider, are we really using smart technology for all it is? It's not just a single platform. Whether you're using those iPhones for MedAdmin, you're using them for clinical communications or secure messaging, clinical education, and all of these other tools, let us help make that process easier. With Jamf Setup, a user can update configuration changes to their own device, trigger updates when you're ready without opening an IT ticket. And with Jamf Reset, a device can be wirelessly wiped and refreshed to factory standards without any PII remaining on that device. Today, these apps can ensure that provisioning and refresh workflows happen when they're needed. And with our new single login preview workflow, this extends apps even further. With secure device access, SSO across supporting apps, and a simple logout workflow at the end of the shift, if you want to learn more, we have a single login lab this week. Check it out for more information. And while most days the shift ends as the clinician is departing from the facility, we know at the adoption of telehealth, there's devices now being deployed and used in so many different ways. As your organization looks for ways to increase the adoption of Apple bedside devices or devices to provide remote care, remote monitoring, and support, we also have a team that's here to help. Jamf released virtual visits in 2020 to support the need for quick video sessions whether you're inside the walls of the facility or externally. And if your organization is deploying devices home to support patients outside of the hospital or clinic, Jamf tools can continue to enhance that experience by all parties. So, how does all of this happen? It happens through our partner network. And as we start to dive into what is the partner network and how do Jamf and Butterfly work together, and what does that mean, and how can we potentially find some of our systems looking at adding to our Jamf platform? We work to support development, workflow improvements, and develop go-to-market strategies. And why would an organization want to partner with us? Well, collectively, whether it be Jamf, it's Butterfly, or any of our other partners, we want to ensure, independent of who you're working with, that your team can quickly utilize the tools that you have and have them integrate and reduce the amount of IT spend and work needed to adopt these tools. And how can you help? If you have any applications, any tools, tier one apps that are in your environment that you feel like there could be an enhancement to the development and management, please let your resources at Jamf know. And our team, my team, will work to reach out to those partners, develop a conversation around how do we provide API guidance, development tools, training, and maybe a go-to-market strategy like we'll talk about in a minute with Butterfly. The partner team alongside your team or the organization developing the apps, we collectively make sure that everything you need is there, from collecting data, creating case stories, win stories, and making sure that your team is educated and have everything you need. But more importantly, let's learn more about Butterfly Network and why you too could enhance the way you support patients and teams wherever they're accessing care. So, Brandon, can you share a little bit about who is Butterfly and how your organization is working to change people and how they're being provided care?
Absolutely. So, just as a little background, Butterfly Network is a handheld ultrasound company. This company has, in the last 4 or 5 years since we've become commercially available, fundamentally changed how ultrasound is performed and assessed. For those of you not familiar with ultrasound, traditional ultrasound is generated by something called the piezoelectric crystal. These crystals are grown in a lab, they're expensive, and they're often fragile. So, in 2011, Dr. Jonathan Rothberg leveraged his experience using semiconductor technology, which he applied to rapid sequencing DNA, and actually thought, wow, could we apply this to ultrasound? That combined with one of his close family members needing frequent imaging and that imaging not being easy to get or readily available, formed Butterfly Network. Like many things that have moved on to semiconductors, once you take a technology and put it on a semiconductor chip, you're able to get scale at a reduced cost. And so that's what we've done here at Butterfly. We've created this portable device leveraging a semiconductor chip that's incredibly flexible, incredibly portable, easy to use, and efficient and flexible. So I'd like to just talk a little bit then about Butterfly's mission and vision, and then we can go a little bit deeper. If we look at healthcare today, there's so many decisions that have to be made. Oftentimes, they may have incomplete information, and all too often, a decision is made without imaging. They say a picture is worth 1,000 words. So when you think about a stethoscope, it's great that you can hear into the human body. What about being able to see into that human body? And so, as we think about Dr. Rothberg's vision, his vision and mission are really quite simple. I'll read them here. In terms of vision, all people everywhere get the right care driven by the right clinical decisions at the right time. Pretty straightforward, something I think we can all get behind. When we think about the mission, create access to valuable clinical imaging insights using innovative ultrasound technology, leverage artificial intelligence to benefit patients worldwide. One of the things we'll also talk about today is how Butterfly is doing this, not just in the US, but globally. And so I'm personally very invested in this vision and mission. I think a lot of people have gotten really excited about it. Jonathan has a quote he mentions frequently, and we talk about this actually a lot amongst our team. The quote says, Butterfly was founded to democratize healthcare by making medical imaging accessible to everyone around the world. So to do that, it's made possible with a probe that fits in your pocket. It can be produced in masses. And the ecosystem, though, is a lot more complex than that. Whether it's a major hospital or a rural community, there are complexities to overcome. Sometimes it's a security policy, sometimes it's a storage aspect, sometimes it's not even having electricity to charge the device. And so finding partners like Jamf, Butterfly and our partners have really made this possible. As Brianne said before, just like Jamf can't do it alone, we can't do it alone either. And so, again, working with a company like Jamf, an MDM solution, has made this possible. Each hospital has a slightly different configuration. We've seen every imaginable configuration out there, and just when we think we've seen everything, a new one comes along. And so, building that flexibility into our system has been critical. And then partnering with people like Jamf and MDM vendors out there has made it possible.
Wonderful. Thanks, Brandon. And so, as healthcare goals and customer needs have changed, we've seen how systems are approaching technology. Jam's spending time working closely with each of these partners. One, to understand how is it helping the health system, the clinical team, and almost more importantly, how is it hindering patient care? What are some of these common considerations brought to our attention to ease the deployment and management of these devices and the ability to access the tools that they need when they need it? So we talked about this a little bit earlier on some of the ways that Jamf is deploying into health system to minimize the interruption and decrease the amount of hands that are needed on the device if they're not specifically working in their role and their job description. We set up and reset healthcare listener and virtual visits. There's a lot of ways that we partner with organizations, just like Brandon was starting to mention. And I'm so excited to be working alongside the organization. I have to say, when I met with Brandon at one of the global conferences this last year, seeing it in action was amazing. And just really taking in the breath of all of the opportunities that this is providing, no matter who you are or where you are. And being able to take that and go beyond the walls of the hospital. And the way that we start the potential partnership is looking at what is that ability for us to partner and be better together. And in the organizations, we look at if they're able to utilize the system to make the process of logging in, logging out, updates, all of that easier, it's a win for all. And Brandon, can you tell us, how did you guys decide that integrating with an MDM would really help your organization?
Sure. It's kind of a funny answer, but frankly, we had no choice. Like any good product company, we sat and looked at our users. We watched hundreds of users over probably thousands of hours of observation, and we were really impressed with ourselves. Right? We took this technology, we moved it onto a semiconductor chip, we built the world's most affordable ultrasound device, and we saw that users were having trouble logging in. Who would have thought that that was the biggest issue, right? Users couldn't log in. It was too many clicks. They had gloves on. They couldn't use facial recognition because the devices were shared. There were just so many things that made usage decrease, right? We gave them every reason to not want to use our device. And so when we looked at how do we fix this? How do we streamline this? How do we reduce clicks? We said, well, a lot of it has to do with login. And that was a perfect use case for Jamf. So when a major hospital system goes and deploys our devices, you often have to log in through a special URL, um, because it ties in with their security systems, because it gives them their own domain. And so what did we do? Well, by using a custom app configuration, we were able to actually send that configuration directly to the device and bypass all those initial steps. So when they opened up our app on the device, they were immediately presented with the login page for their institution, and they were just ready to go out of the box. We'll talk about it a little bit more later, but there's a number of other cases that we've used Jamf for as well. Things like auto logout. Shared devices is a big use case, right? In many instances, not everybody has a device that they're using. And so being able to not only log in quickly, but log out quickly. There's tons of use cases. I'm not even sure that we've discovered all of the use cases for an MDM, but I can tell you that when we get them deployed with a custom app configuration, it suddenly makes the light bulb go off with our customers and things start to click.
Wonderful. Can you share a little bit more about your approach and how you're streamlining that care?
Absolutely. So, as you may imagine, Butterfly was developed to be used anywhere and everywhere. We've created this incredibly portable technology, this incredibly flexible technology. I should have also mentioned previously that ultrasound is traditionally done with three probes. So we call them three transducers: a curved, a linear, and a phased array. And depending on the part of the body that you're scanning, you would use that probe. Because we're using a semiconductor chip, we're actually only able to have, we only need to have a single probe. And so, whether you're in an emergency room, whether you're in a desert in Africa, or even on the base camp of Mount Everest, which, by the way, is a place that a butterfly probe has been, we have to be incredibly flexible. So, we have that incredibly flexible probe. We have to make the rest of the experience flexible. And again, this is not just flexibility with hardware; it's flexibility with software and configuration. So, this is one of the core tenets in everything we can do. IT, we work with them a lot, and we know that they're, if not the most critical stakeholder, one of the most critical stakeholders. And so every customer we talk with, like I said, wants something different. And so our ability to give that flexibility is paramount. Some want them very locked down. Some hospitals and customers want them more open. By leveraging a configurable architecture, it's made it possible.
That's great. And
Sure.
so
So let me just talk.
you're
Oh,
everywhere.
I'm sorry.
Tell
Go
us
on.
about it. No worries.
Yeah.
Just wanted
So
to learn a little more about your app and where you're at.
absolutely. So, Butterfly really is everywhere in the world. Flexibility, I can't say it enough times. I sound like a broken record. Today, we use four configurations to handle our flexibility. The first one is around that domain login. When configured, it reduces 3 or 4 clicks. So, not you open the app and you're brought right to that login page rather than having to say that you're an enterprise user, then type in your URL, then click OK, then bring you to the right screen. This cuts all of that. The next one is actually Express Login. In this frenzy of trying to make login quick and doing it during the pandemic when everybody was in double PPE, we actually created a QR code login. But like any solution, the security teams had something to say about that, and so we needed to add some extra layers of security in there. One of those was that in order for a device to be enabled with QR code login, it had to have a 128 character string deployed to it. Once that was deployed via an MDM app configuration, we were able to log in. So that's number 2. Third one is timed logout. Like I said before, shared devices, you want to be able to log out quickly and easily, and whatever the timeout policy is for that institution, so you don't have devices with PHI maybe laying around. The last one is a control for devices that don't have MDM on them. Some institutions have said, we only want hospital-owned and managed devices to log into your system. No problem. We have a configuration in our end where we're able to say, unless this specific key is on that device, don't allow login. And so those 4 really bring not only simplicity and flexibility, but also a secure deployment model. So that's being supported then by Jamf and all other MDM partners out there. So thinking about Butterfly, we have a motto. We talk about our devices being easy, everywhere, and economical. And when we start to enable this through AI acquisition, MDM supported login, this enables us to hit all of these pillars. Major enterprises, countries around the world, users in the home, and alternative care markets, such as the vet space, right? By having that flexible, affordable device, by adding AI, by making it easy to configure, we're able to do it all. And that's really what we're building for. We are building that platform. We're leveraging partners to do it. And so today we're deploying devices in Kenya and South Africa. We're doing testing in the home, and we're working with some of the largest and most prestigious health systems in the world. In doing this, we are truly changing how care is delivered. and we wouldn't be able to do it without the various partners that we have, whether it's our manufacturers, whether it's our software providers. All of that builds out this ecosystem. And so we are so appreciative. We're so proud to work with all of you, and we really thank you.
Well, thank you, Brandon. Such great work. The items and the coverage and the way that your organization and resources are approaching Care Anywhere. If nothing else, I hope everyone understood that there's a great opportunity. And as many organizations today are exploring what is their outside of the walls care, how do they make sure that they maintain the ability to care for people no matter where they are, Butterfly is a wonderful resource for you. And I think we've said it a couple times today, but as the fabulous and famous Steve Jobs once said, great things in businesses are never done by one person. They're done by a team of people. And as I hope you saw today, you have a team supporting you. There's a lot of resources, whether at Jamf, at Butterfly, at all of the different partnerships here to support you and ensure that each of your experiences while using any sort of MDM to manage and deploy the Apple technologies in your system, you're not alone. And so thank you again for joining us, and Brandon, the amazing things you all are doing. We're going to now kick it over for questions. Thank you for joining, Brandon. Thank you all for listening, participating with us. We're truly excited about all of the efforts each of you are doing daily and how collectively we can all partner. So again, check out that lab that we have with all of the technology that the healthcare team is working on. And feel free to reach out to the Jamf or Butterfly team to learn more. Have a great one.
Thanks, everyone.